everybody, welcome to my channel. Today we're gonna start a new series of videos where we are talking about animals and humans. In this first episode we are talking about animal assisted therapy. I'm Rita and today it's all about you. Animal therapy, pet therapy, or animal-assisted therapy refers to therapeutic interventions where are pets or animals used to help people that has certain conditions in a physical way or in a mental health way. Usually the normal kind of animals that are used for this kind of therapy are dogs, cats, horses, guinea pigs and birds. The kind of animal that is used always depends on the kind of issue that the person has. And of course it also depends on the therapeutic goals of the treatment plan. Animal-assisted therapy may be useful for interventions with medical issues like autism, behavior issues, depression, schizophrenia, addiction, and even learning problems or learning difficulties. It can also be used with children that are receiving cancer treatment in specific places like hospitals or long care health treatment centers, and can also be used with other kind of issues like PTSD, heart disease, mental disturbs or anxiety. This kind of intervention usually has good results because it reduces boredom, increase movements, activities through walks or through plays, provide companionship and reduce the feeling of being alone, increase and stimulate social interactions, and improve motivation, mood swings and the general well-being. These kind of interventions can be happened in hospitals, in healthcare centers specific for some kind of treatment, animal specialized centers or any other kind of institutions that agree doing this kind of interventions. An intervention therapy that uses animals or pets may produce the reducement of the pain level, providing comfort and improving the movement skills. And for instance, a child petting an animal can have a calm and comfort effect, can even make her feel a little bit more safe, and can even improve self-confidence. Another example is riding a horse, which has a very positive motor skill development like the back muscles, the balance and even the self-esteem of the child or the individual that is riding the horse, because of the power of or the feelings of control that a person has when he's riding a horse. This can also again reduce stress, improve self-regulation and communication skills and social skills in general. All this process involves a person that takes care of the animal or the pet that we are called a handler, and this handler have to bring and be responsible for the animal, and this person will work under the doctor or the therapist guidance to help achieve all the goals that are the proposal of this treatment. Usually these handlers, they are volunteers, but they have to have a certain certification, and also the animals have to have a special certification to be able to work in this kind of field. Particularly for animals, this kind of certification is rigid in terms of behavior, in terms of temperament, and it's not really something that can do any kind of harm to the animal, because it kind of gives a purpose of what he have to do and what he can eventually do. Of course, this kind of intervention and this kind of therapeutic ways of using animals, they involve certain risks, and it's important to address these kind of risks. In hospitals, it's easy to understand that the sanitation is a risk, and the safety of other kind of disease has to be really a concern for anybody that is promoting this kind of therapeutic intervention in hospitals. It has to be lots of rules, and they have to be severe for a clean and vaccinated animal, and of course well trained with proper behavior for an animal be able to enter in a hospital. But this is possible, and of course there are starting to rise this kind of therapeutic interventions even in hospitals. Another thing that we have to address is that people with allergies, they are not qualified to enter in this kind of programs, and in this kind of interventions are not the right ones for these kind of people. Another risk that we have to address is that somebody can really feel too attached to a certain animal and lead to not so positive behaviors, and we can eventually think that there are some or it's possible to have some feelings of possessiveness that can eventually decrease the therapeutic goal. So there are always a kind of evaluation of the child or the individual for this kind of interventions, for exactly these reasons, and for everybody be aware if a person is suitable for an animal. So it's not just an animal that has to be suitable for working with the people, but it has to be also suitable that a person or a child has to be able to work with certain animals. Of course, this is a complementary kind of treatment and is a kind of intervention that usually it's not used by yourself and should not be used alone, or even be a replacement for other kind of therapeutic interventions. It is a kind of intervention that really involves more than one person, so involves a multidisciplinary team that really works with the individual or with the child in order for the goals be reached as soon as possible. This is a kind of intervention that can really have very positive results, and if everything works, if the person or the individual or the child is suitable for working with the animals, and if the right animal is choose to work with this person, there are really positive results, and this can be something that it's really a value in intervention for many other kind of issues. So that's all for today, guys. I hope you like it. I hope you subscribe to the channel, leave a thumbs up, share with a friend, comment if you want, and next time we're having another episode of this series that we are talking about animals and humans. So I'll see you there. Bye!